Hello again and welcome to Oral Medicine Simplified. I am Dr. Suman Saeed Siddiqui, and in this video we'll discuss common oral mucosal lesions, focusing today on ulcerative lesions caused by viruses. The oral mucosa often gives us the earliest signs of disease. These lesions may appear as ulcers, white patches, red patches, or pigmented spots. Identifying these early can help detect both local oral problems and sometimes even systemic diseases. Let's start with ulcerative lesions. So what exactly is an ulcer? An ulcer is the breach of the continuity of skin epithelium or mucous membrane caused by sloughing out of the inflamed necrotic tissue. Now, there can be several causes of oral ulcerations. They can either be infective, traumatic, caused by radiation. They can also have idiopathic causes. They can be associated with systemic diseases or dermatological diseases, and also neoplasms. But in this particular presentation today, we'll be focusing on infective causes and particularly the viral causes. Now, if we look at the infective causes of oral ulceration, they can be viral, bacterial, or fungal. Today, we will only be discussing the viral causes of oral ulcerations. For the ease of this presentation, I've mapped out a chart that displays some of the infections, some of the viral infections that can cause ulcerations in the oral cavity. So some of the important infections are human herpes virus, cytomegalovirus, Epstein-Barr virus, Coxsackie virus, rubella, and HIV-related ulcers. The most important among them is human herpes virus that will be discussed in detail in this presentation. Human herpes virus is a double-stranded large DNA virus that stays in the body for life. Once a person is infected with this virus, the virus doesn't go away anywhere. It stays latent in the body and can reactivate when the immune system is weak or under stress. So, human herpes virus can cause primary herpetic gingivostomatitis that can be caused either by HSV1 or HSV2. It can cause recurrent herpes simplex that can lead to herpes labialis or intraoral herpes. Then we have varicella that causes chickenpox and herpes zoster that causes shingles or varicella zoster virus reactivation. Now, as we discussed in the last slide, that once a person is infected with herpes virus, the virus stays in that person and can reactivate once the immune system is hit by something. So this picture was taken from an online source called Chemo Experts, and this explains that once a person is infected, uh, the person can have sores that affect the mouth and lips. There are some other symptoms that can be present in a person that can be associated with human herpes virus, that are fever, malaise, tingling, or itching of the area, and this remains for 7 to 14 days. Okay, so this is the time that the virus stays active in this person. It is either 7 to 14 days, and after that 7 to 14 days the virus goes into latency. Where does it go into latency? It is the trigeminal nerve ganglion. It stays dormant there, and it does not cause any pain to the patient unless the immune system is hit. The immune system can be hit either in high stress levels, when the person has insufficient sleep, or if there are any medication uses that can suppress the immune system. Human herpes viruses are classified into herpes simplex virus 1 that causes oral herpes, herpes simplex virus 2 that causes genital herpes, human herpes virus 3 or varicella zoster virus that causes chickenpox and shingles, human herpes virus 4 or Epstein-Barr virus that causes infectious mononucleosis and oral hairy leukoplakia, human herpes virus 5 or cytomegalovirus that causes opportunistic ulcers or congenital infections. HHV6 and HHV7 are roselloviruses that cause Rosella infantum or ulcers in immunocompromised patients. And the last we have HHV8 that causes Kaposi sarcoma that are associated with herpes viruses or Kaposi sarcoma in HIV or AIDS. Herpes simplex viruses can present in different forms. The first episode is called primary herpetic gingivostomatitis, while later reactivations appear as recurrent herpes infections. They can also lead to Bell's palsy, erythema multiforme, or herpetic vitello. Moving on with primary herpetic gingivostomatitis, which can be a subclinical infection that can occur in children, teenagers, and young adults, but not infants, as maternal antibodies provide immunity to fetus for 6 months of life. These infections are self-limiting, primarily infecting the anterior part of the oral cavity, and almost always there is an involvement of gingiva, hence the name primary herpetic gingivostomatitis. In primary herpes, erythema with clusters of vesicles and ulcers appear. These can involve both keratinized mucosa, such as the hard palate and gingiva, and non-keratinized mucosa, like buccal mucosa and tongue. The mouth is extremely painful and the gingiva appear red and swollen. After the first infection, the virus remains hidden and may reactivate. Patients can shed the virus asymptomatically in saliva, which makes it transmissible. The triggers include fever, trauma, stress, menstruation, and respiratory infections. When herpes recurs on the lips, we call it recurrent herpes labialis. It affects about 20 to 40% of young adults. Patients may feel itching, tingling, or burning before the vesicles appear. The ulcer then crusts and heals within a week. Recurrent herpes labialis usually affects keratinized mucosa such as the hard palate, attached gingiva, and dorsum of the tongue. The ulcers are 1 to 5 millimeters in size. They are single, clustered, or they can be clustered, and they are painful with red borders. This is again a picture taken from online sources. I cannot recall what the page was, but however, it very well explains the stages of cold sores. So what can be expected? In stage 1, there is tingling, itching, and soreness of the mouth. Then small, hard, fluid-filled blisters form around the lips. Now we are discussing herpes labialis, that is called cold sores. Then the blisters burst and ooze fluid. We can see open sores or scabs in later stages, but eventually the scabs fall off and the cold sores heal by its own. So let us discuss the pathogenesis and etiology of the primary herpes simplex. After the initial exposure, there is insertion of the virus in mucosa, skin, and eyes with the infected secretions. Virus then travels along the sensory nerve axons, where it establishes chronic or latent or dormant infection in the sensory ganglion or first order ganglion, such as the trigeminal ganglion. Now, once there is a hit in the immune system, either by stress, menstruation, any medication, lack of sleep, the HSV reactivates at the latent site. It travels centripetally to the mucosa or the skin, and it is directly cytopathic to the epithelial cells. It causes recrudescent HSV infections that are localized vesicles or ulcers. If HSV infection infects the eye, it can lead to keratitis, which is a major cause of blindness in the world. So this is a very important thing to note, that the major cause of blindness is the keratitis caused by HSV infections. Moving on to the treatment of herpes simplex viruses. As we all know, viruses have their course of their own. They are usually self-limiting and they go within 7 to 14 days after completing their course. So we cannot do much in treating the viruses, except that we treat the symptoms of the patient, which can be fever, pain, malaise, etc. So for the fever and pain, we usually prescribe paracetamol to the patient. Then the patient can also be dehydrated, so IV fluids are usually required because the fever causes dehydration. Then the patient can also avoid eating or drinking from their mouth because of the cold sores, because of the pain that comes with the vesicles and the ulcers. So the patient can be dehydrated and IV fluids can be necessary. Then we can also prescribe some multivitamins and protein sources to boost up the immune system of the patient so the virus can go away or become latent early on. Then to reduce the transmissibility of the virus, we have some antivirals that can be either oral or topical, such as acyclovir, famciclovir, valacyclovir, or penciclovir. Oral acyclovir suspensions are given for the effective treatment of children with primary herpetic gingivostomatitis, and oral acyclovir, valacyclovir, and famciclovir are given in the acute recurrences of herpes labialis, whereas topical acyclovir, penciclovir, and docosanol are given as optional treatments for recurrent herpes labialis. We can also prescribe a daily dose for oral acyclovir and valacyclovir in patients who have recurrences of herpes labialis. Then let us discuss the varicella zoster viruses that can or the herpes zoster viruses that can cause chickenpox or shingles. So chickenpox is the primary infection, whereas shingles is the secondary infection. Chickenpox or varicella zoster virus are transmitted through respiratory secretions or vesicular fluids, and the herpes zoster virus or shingles is by reactivation of the latent varicella zoster virus. The signs and symptoms of chickenpox are malaise, fever, and rash, whereas for the shingles it is neuralgia, dermatomal rashes, weakness of the affected nerve. The distribution in chickenpox is more towards the trunk initially, then progressing to face, extremities, mucosa, or a combination. Whereas in shingles, it is primarily or 50% thoracic, then the remainder is cranial, cervical, and lumbar region. The characteristic of the rash in chickenpox is non-grouped and itchy vesicles, whereas in shingles the rash are grouped markedly erythematous, and painful vesicles. This picture shows a person with shingles. Now, as you can see, there is a clear demarcation over here. This is following a single dermatome. It is not crossed. The ulcerations are not crossing the midline. They are not crossing the other nerve area or dermatome area. It is strictly in the ophthalmic and frontal region of the face. Okay, so I'm going to end my presentation over here, and we will be discussing some of the cases of herpes infections in the next presentation. Till then, thank you for watching. Please like, share, and subscribe to Oral Medicine Simplified for more topics explained in an easy way. Thank you.